Hello and welcome. I'm Fernando, a GP in the UK. Today, we're looking at the NICE updates published in July 2024. This month, we have not had any new guidelines or quality standards, but we have had a few new technology appraisals. That is, when NICE reviews new treatments to decide whether they should be recommended on the NHS. Apart from some radiotherapy recommendations, there were 5 other new treatments. Although none of them were really relevant to primary care, I will give you a very quick overview so that we understand where new therapies are coming from and so that we have some knowledge if we come across them. And don't worry, it is a real summary and today will be a very brief episode. So let's jump into it. The first area refers to the treatment of moderate to severe atopic dermatitis or eczema. We know the standard treatment includes the topical use of emollients and steroids. If these treatments are not effective, systemic immunosuppressant treatments such as cyclosporine and methotrexate can be added. If there is an inadequate response or they're unsuitable, other agents such as Janus kinase inhibitors or a biological medicine can be used. NICE has evaluated a new biological medicine alternative, lebrikizumab, and indirect comparisons with Janus kinase inhibitors and other biological treatments suggest that it is equally effective at an acceptable cost. The biological treatments, lebrikizumab, dupilumab, and tralokinumab, are monoclonal antibodies that inhibit interleukin processes, thus reducing inflammation and modulating the immune response in conditions such as eczema and asthma. They are administered via subcutaneous injection and they can now all be used as treatment options. The next area covers the treatment of acute ischemic stroke. We know that once an intracranial hemorrhage has been ruled out, thrombolytic treatment can be started within 4.5 hours of the onset of stroke symptoms. The current standard thrombolytic treatment for this is alteplase. Tenecteplase is an alternative to alteplase. Tenecteplase, just like alteplase, turns plasminogen into plasmin, an enzyme that digests fibrin and acts like a pair of scissors to cut up the fibrin mesh in the clot, leading to clot dissolution and restoration of blood flow. The evidence shows that tenecteplase is at least as effective as alteplase, and the cost comparison suggests that it is less expensive. So it is also recommended. The next area covers the treatment of cystic fibrosis, which we know affects the lungs, digestive system, and liver, and which reduces life expectancy and quality of life. Usual treatment is physically demanding and time-consuming for patients and the carers. There are a number of tongue-twisting treatments, namely ivacaftor, tezacaftor, elexacaftor, and lunacaftor, which work by improving the transport of chloride across cell membranes, which in turn helps to hydrate and thin the mucus, particularly in the lungs. They have been shown to improve lung function, growth and weight gain, and reduce the number of lung infections. They come as tablets or sachets, and although expensive, NICE considers them to be cost-effective, so they are recommended. The next area covers a gene therapy for Haemophilia B, etracogene desaparvovec, which reduces the number of bleeding episodes a person has each year. However, there is not enough evidence on how well it works in the long term, so it isn't clear as to whether it is cost-effective. It is therefore not recommended for routine use in the NHS, but it can be used with managed access in order to try and collect more data. The final area refers to the treatment of certain breast cancers with a combination drug, trastuzumab deruxtecan, which works by combining a monoclonal antibody targeting cancer cells with a potent chemotherapy agent, delivering the chemotherapy directly to the cancer cells. However, the cost-effectiveness estimates are unacceptably high, so it is not recommended. So that is it, a very brief review of the new treatment updates. We have come to the end of this episode. Remember that this is not medical advice and it is only my summary and my interpretation of the guidelines. You must always use your clinical judgment. Thank you for watching and goodbye.